My name is Kieron Lim. I am a gastroenterology and hepatology specialist at Mount Elizabeth Hospital in Singapore. Prior to starting my practice at Mount Elizabeth, I was at National University Hospital, where I was the head of gastroenterology as well as the medical director for medical transplantation at the National University Centre for Organ Transplantation. I think there are two main groups of patients that should be considered and evaluated for liver transplant. Large majority of patients that fall into the first category are patients with liver cirrhosis, and in particular patients who have more advanced cirrhosis or complications of cirrhosis. This is also known as decompensated liver disease. Such complications include jaundice, fluid accumulation called ascites, confusion or encephalopathy, as well as the development of blood vessels called varices and bleeding from such blood vessels. And last but not least, the development of primary liver cancer or hepatocellular carcinoma. So patients who have such complications should certainly be referred to and evaluated at a liver transplant center. In Singapore, we have both cadaveric liver transplants, which are unable to meet the demands of the number of patients on the waiting list. And most of the transplant centers in Singapore get around that by being able to offer living donor liver transplants. Predominantly, the donors are relatives of the patients. However, in Singapore, on a case-by-case basis, patients who have emotional relationships to the potential donor, this donation can be considered and has been approved in the past by our National Transplant Ethics Committee. So in Mount Elizabeth Hospital, we are privileged to have a large team of experts in various fields of liver transplantation. Such specialties include, of course, liver transplant surgeons, transplant hepatologists, as well as critical care specialists, infectious diseases specialists, as well as a very specialized nursing support, nurses in ICU, in the operating theatre, in anesthesia, and all these are specifically trained to look after such complicated and complex cases of liver transplants.